it's Dr. Katz again. I've got the next segment in our Audible blog series. This one is called, So When Should You Take Your Kid to the Gynecologist? This is a hot topic, trust me, and one that a lot of parents struggle with. So here goes. So I'm going to go ahead and read the blog, and let's see what you think. Well, I'm glad you asked that question. Being a gynecologist myself, I am all over this one with wise tips and safe knowledge. First, let me say that yes, I've seen all the newsflash and articles about teens suffering through unnecessary exams too early. Yes, I've read them all. I'm also well versed in all the national recommendations. Having said that, let me break this down according to my perspective and explain how I go about the practice of adolescent gynecology. I want to first start off by saying that to my knowledge, no teen has suffered at my office that I know of, or at least they've not spoken up. Usually they leave the office relieved that it wasn't as awful as their friends, Google, or random promiscuous acquaintances said it would be. So let's clarify some of the current national recommendations on pap smears, okay? So first of all, the USPSTF, that's the United States Preventative Services Task Force, all right, recommends screening for cervical cancer in women ages 21 to 65 years with a pap smear every 3 years, or for women aged 30 to 65 who want to lengthen the screening interval, screening with pap smear and HPV testing every 3 years. Women over the age of 65 with adequate prior screening do not require further screening. Women who've had a hysterectomy with the removal of the cervix and don't have a history of high-grade dysplasia also do not require further screening. Now that we have that all settled, here's a few caveats and things to clarify. First, these recommendations are based on statistics and costs, i.e. how expensive it is to identify and take care of someone with cervical cancer versus how much it costs to screen everybody, and epidemiology, which is how long it would take abnormal cervical cells to progress into something serious. Okay, so second, these recommendations often come from a panel of folks who may or may not have seen actual patients in a clinical setting in a very, very long time. Third, these recommendations only refer to the pap smear guidelines. This can be very confusing for women because when they hear no pap smear required, they tend to think that means no exam required. I can't speak for other offices, but in my office, the pap smear is a mere 30 seconds of the entire head-to-toe exam that I perform on my patients and is by no means the end-all be-all. That is, in my opinion, very dangerous because there are many gynecologic conditions that don't present with symptoms until late stage and increased severity. If the average woman goes and gets no checkup and just waits for symptoms, she could already be facing a life-threatening condition that could have otherwise been picked up on and treated. Ovarian cancer symptoms can be vague, like just some bloating and decreased appetite. Vulvar cancer can present as a minor itch. Without significant contortionist abilities and a headlamp and some Superman vision, I find it difficult to believe that the majority of women could accurately self-diagnose at an early stage. Just saying. I recommend at least getting an exam every year, all pap smear recommendations aside. The other thing that I find difficult to swallow about these recommendations is that they seem to be attempting to weigh what a human life is worth. I feel like we're saying, well, it's just too expensive to watch out for all of you long term and actually use our technology to catch everything early, so we're just going to hedge our bets and go for the cheapest option because it'll likely end up in our favor. Chances are good. So for the handful or more of patients that get missed, oh well, I would challenge any actively practicing physician to look a patient whose preventable diagnosis was delayed and look them in the eye and hide behind those recommendations with no regret. So now let's get back to teenagers, right? We got a little off track, kind of. So let me preface again before we go on that what I'm about to say is based on fact and my personal opinion combined. I'll try to be very clear on which part is which. So here's what I tell parents when they ask when they should bring their teenage daughters to me. I first recommend that a patient start visiting me when she first starts having a period. This is time to have a good, honest, clothing on discussion with the adolescent about her body, what to expect, and evaluate whether she's having any menstrual difficulties, etc. If applicable, we can also have an open discussion about sexual pressures and peer pressure. I also use this as an opportunity to offer myself as an unlimited resources for any future questions she might have. This visit does not necessarily involve taking off any clothes or getting an exam. These kind of visits can be carried out on an annual basis, accounting for good decision-making until the patient reaches 21 and screening can begin. Now, however, we all know the age of first intercourse in the United States is getting lower and lower. I have 12 and 13-year-olds in my practice that are already experimenting with sex. A lot of the time, the parents either do not know or are not prepared or are uncomfortable in dealing with this situation, and therefore the patient goes unchecked. High-risk behaviors evolve out of lack of resources and information, and lots of potential problems come up. I truly feel that if these patients were to have the opportunity to establish with me, I could help tackle some of these issues and at least attempt to help keep the patients safe or show them how to keep themselves safe. If I have an adolescent patient that's engaging in high-risk behaviors like multiple partners or unprotected sex, etc., I may want to do an exam for several reasons. First, even though I realize that some sexually transmitted infections can be screened with urine and blood, there are some that can't. For example, I can't tell if a patient has genital warts that need to be treated without an actual examination. Second, it's my personal opinion that there's a certain amount of responsibility that should accompany the decision to be sexually active. And part of that should include the patient being healthy, like getting an exam rather than peeing in a cup and waiting confidentially for results. I think that when we foster a disconnect between our teachers and their decisions, it only compounds the potential for disaster. Third, this subgroup of teenagers is at higher risk of HPV and eventually cervical cancer. I realize that according to statistics and epidemiology, it is likely to take years and years for this HPV or cervical dysplasia to develop into something serious like cancer, and that it does have a chance of resolving on its own. I get it. I also realize that part of the logic in these recommendations is that the teenage population would be more at risk for having unnecessary procedures for conditions that may resolve spontaneously. I assure you, I'm very cognizant of not doing just that. And even understanding all that, do we really want to just throw the dice and wait and not even involve the adolescent in her own gynecological well-being until she's 21? I just have a hard time with it. Well,